I think it's safe to say that everyone in Fiji is now a whole mix of emotions. There is, of course, a big pervasive fear in the community. There's still a lot of confusion given that things are deteriorating rapidly and we're not hearing a lot from our government, especially with things that are confusing. Although earlier tonight, the Ministry of Health did give us their first update of the month. There is also a lot of frustration as people continue to call for lockdowns.
You yourself have extended family who have been devastated by the virus and you have a personal story to tell.
Yes, that's right. And in fact, that particular death was only announced in tonight's update. And it's indicative, I think, of the situation here where deaths are happening quite senselessly. In my case, it was an aunt, a close member of the family who was only 32 years old and who contracted the virus and got to the hospital quite late. And so the doctors had to make a decision to save the baby that she never got to see and passed away a few days later, sadly.
Really a sad story. How vulnerable are pregnant women to COVID in Fiji, and how are health authorities addressing their needs?
Pregnant women are quite vulnerable, sadly, and confidential paperwork that I acquired over the past few days showed that actually in the Colonial War Memorial Hospital, the main hospital here in the capital, Suva, it is the maternity ward where the most cases are coming from. And so what's happening is that there is a lot of fear in the community over the vaccines. And so, of course, there are a lot of people that are still not coming forward to receive the vaccine. And so what we're seeing now is that pregnant moms are turning up at the hospital quite severely infected by the virus, and of course passing it on to doctors and nurses working in that particular area. Now, what's happened over the past couple of weeks is that our government has managed to come to an agreement with the government of the United States of America for the supply of Moderna vaccines, which, as I understand, are supposed to be safer for expectant women.
And you mentioned before that people are just confused about what to do. What is the most confusing in terms of the message that the government has been sending out?
I think the confusion is quite widespread right across this response, but the particular problem areas, as I've seen them over the past 3 months of this particular outbreak, is one, in the area of vaccination. The vaccines were made available well before the awareness programs went out into the community areas, and what we've seen over the past couple of months is a heavy reluctance or hesitancy in the rural area, particularly amongst the indigenous population. Or rather, I should say, the Christian population seems to be where a lot of the hesitancy is coming from. And so there's not a lot of community communications effort working to address that. Secondly, with regards to getting tested or getting swabbed and being able to get checked if you suspect that you have the virus, there's still a lot of confusion over, which numbers to call, and when the numbers get called, they don't get answered. And also, what the protocol is if you have a symptom, whether to call for the government to come and pick you up or whether to find your way to a health facility. And just tonight, the Permanent Secretary for Health and his team clarified that position to say that they're actually no longer testing in the community now and no longer prioritizing the return of results to people outside of the population they think will develop severe and therefore critical conditions as a result of the infection.
And what is the goal in terms of vaccinations across the country?
Well, it looks to be the government's main response or the main strategy is to get 80% of our adult population. So that's 80% of about 580,000 people, which is what our adult population is meant to be. So that's just under 480,000 is the 80% of the adult population that the government thinks is sufficient to achieve herd immunity. And they're hoping to do that by the 31st of October, which is not too far away. And as of today, we're only above 14% in terms of fully vaccinated Fijians over the age of 18.
Lice Movono, thank you so much for updating us from Fiji there.
Manaka.